pull both sides here and here. Now it's okay, and here you go. So yeah, because it's so like secured, eh?
Yeah.
So it's not going anywhere. This is the way actually the good. So palpation start forms has a lot of mark here, skin. I don't know what's that mark. Do you have any skin infections before?
No.
Okay. So and you can just do some more without lubricant.
Yeah.
Smoothly. Give some stretch as well as on these sides. Make sure you're comfy, eh? Take a few deep breath. So if the client, if you see the client is a little anxious, so what you will advise your client? A little anxious, anxiety, like first time massage or first time advice. Okay. So what you will advise your clients? So you just call, and what you call that breath is deep diaphragmatic breathing, eh? Deep diaphragm breathing. Are you okay? I'm going to get some stretch on your back. The cross arm stretch. It's good for the myofascial, is it? Myofascial release. This is myofascial. This is skin, fascia, and other soft tissue structures the involved in the myofascial release. You can just do the both sides here. Okay. And there's a craniosacral release. You can just do. You have to put your hands over the SI joints here, and this side, this hands here, or the at the back, upper back or cervical, the base of C7. You can see, feel the C7 here. Put your hand here and just stretch straight. Are you okay?
Yeah.
Pain? Okay, perfect. Now you're better. Okay, just put your oil. Should be pretty cold, eh? So that's why we just have to. Yeah, it's not good for the client, but definitely it's okay. We can just do Surfrage properly, lighting. Use most time you have to use your hands, palms, eh? Hands good. Then if you want some specific pressure on some specific part of the body, then you can use your forearm. But if you're a big client, definitely your hands gonna be tired, eh? The big client or thick one.
Use forearm.
Okay. So what I do, I start from like whole, what we call them. Start from the sac, like cervical, thoracic, lumbar, and sacral, as well as at the tip of the sacral here with SI joint, both sides. Okay. Then I do some work at the neck. Are you okay with the pressure?
Yeah.
It's just compressions with the fingers, both sides, and here also the compression. So direction should be like this, horizontal, eh? Not vertical. Why? Because it's the physical, eh? You're gonna just put a lot of pressure there, physical, and you can just do some occipit. The base of the occipit.
Pasa mo yan sa akin, well, ah.
Need more oil because my skin is very dry. Perfect. Here you go. So then I just put my tips of the finger here and slide. You can say the glide slowly. And on the spine, not on the spine, eh?
Yeah,
So on the spine, and then you have to hold here your hand and just put your thumbs over both SI joint and hold it here. So you can just squeeze. Do some frictions, circular frictions, because this is the point for adhesions, eh? More adhesions here we have. You can just do squeezing like this. Are you okay with pressure? And then you go back here at the back. Wait. Don't just because muscles are gonna contract. It's not good for me. Eh?
I hate you early.
Okay.
It's your
But I
fault
love
too,
you.
actually. Okay.
This is
And
the
there's a
best
zig.
answer.
This technique I just want to show you, man. This is called the zigzag technique. Eh? You have to put your fingers here.
Zigzag.
One, yeah, I do this.
Oh, zigzag.
Zigzag technique, eh? On the both.
What is the benefit on that?
All the benefit goes to the muscles.
Of
You have to-
course.
Yeah.
Zigzag.
Yes, there is no benefit personally For
Just
me,
loosen up the.
yeah, it's a loose
tight
shoe definitely. The
muscles.
tight muscles, you know what?
It's different
And this is
technique.
what you do. And then you can use your
Yeah, I like the.
Like
yeah,
ulnar border of the
that's your
hands.
signature, actually.
Ulnar border of the hands, and then you
Oh,
can
your
just do.
signature dog.
Then you can just do like wrong along the margin of the iliac crest from SI joint, iliac crest. So this is the point for the origin of glutes maximus. This is no, it's under more deeper. You can use the heel of the hand here.
Expert.
So use the heel and make your arms straight, because it's not just gonna bother your hands. Straight, and just move here along the border of the scalp. Come here,
QL.
squeeze, and just go back from here. Okay. Sometimes I'm still here. I'm not just going to any other sides. I can do my shoulders as well as. The space is not good for me. I'll try. So here you have to push the both shoulders
That's good.
and just do some squeezing. And this is practice as all.
Yeah.
There's no more approach.
It's like you're pushing it with your.
Exactly. Use your body weight.
Mhm.
Remember, there's a mechanic, body weight, not your arms. Pushing more down. Are you okay with pushing? And then just you have to glide your hands like this.
Oh. You're pulling
Make
his
a fist.
ears? Oh,
Yeah.
no.
No
In the
ears.
ears? Oh, you
Mastoid
just the
process.
mastoid process.
Process. Okay. You okay? How's the pressure?
Good.
Then you can just use your tips of your fingers.
Sana. That feels good.
This is called the piano. You're playing piano.
Piano. So piano.
It's good.
And then you just have to squeeze at the base of the occiput, because there's a point for this certain muscle attachment of the
Yeah.
neck muscles, vertebral muscles, spinal muscles, and at the side as well as we have here, yeah, the whole like a trispanic group of muscles, and then we have the spleen is okay, posterior lateral, splenius, anterior lateral is scalenes, more anterior we have SCM. And you can just squeeze the neck like this. Okay. Do FRH again. Repeat. You have to keep the tissue warm, all the time, all the way, 6, 7, 8 strokes, slowly, and then take your side, one side. So I'm just taking this side, so I'm working only this side. Then your work is more specific, And again, do FRH. Like this. And I'm more focused on the shoulder here. Then I'm just gonna grasp the muscles, trapezius here. Okay. You can feel it, in your tips.
It's
of
not
the
hurt,
finger.
Johnny. It's strong.
Why it's gonna be hurt?
Because you're squeezing.
But this is very light pressure. It's not a deep one. I'm not just going to like.
Slight.
So light pressure is important. You can just
You will
focus.
scream if it hurts.
Are you okay?
Yeah.
May ano ako.
So you can just do some jostling.
Ano ang tawag yun?
Okay, some vibration. Okay. So I'm more specific now. I'm just working on according to muscles group here.
He doesn't know where to go.
No, I focus
Supraspinatus. Use your thumb. You can feel this spine here. This is spine. Supraspinatus. Okay. You always ask me. You're touching my client.
Yeah.
It's totally unethical,
Sorry.
So how you just massage if you don't know the ethics of the massage? I'm wondering. So in first spinatus now, there's a big muscle here. You can just strip. There's a whole stench. You're just putting your body weight, whatever your body weight, not your body weight. If you find some knots, you can just do some friction. Are you okay with that pressure? Are you sure? It's hurting?
A little bit.
Little bit is okay. So you can just work and just squeezing, gliding deeply towards down, You know, any pressure you apply towards the gravity is more easy for you instead of working against the gravity upward. So push this thing downward.
Yeah.
And you should know the direction of the fibers of the muscles here, like supraspinatus, infraspinatus, rhomboids, okay, trapezius, like this. All these directions, you just work on the direction. You can use your knuckles. Okay. If you just think that your hands are just tired, so you can just do knuckles as well as squeezing, okay, with the pressure. Are you okay?
Yeah.
Here is good. Actually, you can just do like knuckles. You're using only, don't use your hand, using only your fingers. At which joint? Metacarpophalangeal joint. So you can just do it easily. So there's so many things we can just do. Like when you just work on like rhomboids and spinal muscles, paraspinal muscles here actually. So again, you just do some approach. Make the area more warmer. Don't need a lot of pressure here. Because you're focusing here, not this part. You can just do it later, right? That's why you just go one by one. And this is the way you just do massage. You can use your heel of the hand for medium pressure. Medium to deep you can use, with the heel of the hand, with your body weight. Keep your arms straight. If you just do like this, it's gonna hurt your elbow.
Yeah.
Keep your arms straight. Are you okay with pressure? Hmm?
Yeah.
Yeah, stay here. So when you will reach to the joint, hold it, and stay here, and then just go do some squeezing, circular movement here. And you can just glide downwards again, okay, towards the gravity. You can just repeat it here. Now my work is still there. So how you identify it? Can you just move your arm there at the back? Now you identify the middle border of the scapula. This is inferior angle of the scapula, and this is the spine. What muscles we have here? Rhomboids.
Rhomboids.
Direction is like this. So better you just push towards the spine, or you just pull towards the medial border. And this is the way you can just do it. Because not only you're working only the rhomboids, under muscles also we have trapezius superficial. You're working automatically on layer of muscles. It depends how much pressure you apply. If you apply deeper one, you go for deeper work, like paraspinal muscles, intermediate, superficial, intermediate borders. So here we have spinalis, and then we have what? Transversalis, and the transverse process, and then we have more lateralis, iliocostalis. Okay. So what band you feel here? This is typical iliocostalis. And they're stuck. Actually, you are not doing anything within the muscles. You're gonna separate the muscles from here, 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 here. Or do we say it cannot move actually if you don't direction of the numbers? So if the prominent is flexible body, young body, you can just where is the prominent, use your hand here and pull towards you, hold it, you just stretching it. So this way you can just give stretch subscapularis muscle, because muscle is deep underneath, you cannot do directly massage. So you only can just do the stretch. So and it's not only the stretching, you're stretching other muscles as well as hold it. Are you okay with pressure?
Yeah.
Make sure the client is okay, tolerable. Are you okay?
Yeah.
Perfect. What I do from the other side actually, because I push the other side. Again, you just do approach. Okay, can you just come this side? There you go. So if you want to do good stretch, just relax. Relax. Take your deep breath. See? And hold it. Scan this down, remember BNF1. So if you don't hold, if you just do it quickly, cause it contractions. That's what we don't want, contractions. We want to relax the muscles. If you just hold it at least for 30 seconds, it sends impulses, message to the brain, and the brain relax the muscles. And this is the way we just do hold. And you need patience. What are you doing? This is your massage. This is not massage. Be therapeutic. Just understand the mechanism.
Slowly,
and understand the demand of the tissue. every tissue has different demands, eh? That's why. Are you relaxed?
Yeah.
Okay. Perfect. Your hold. Are you okay?
Yeah.
It's a very good stretch. Some people they can just hold it. Now you just can straight your
Go
arm.
ahead.
I'm still here, eh? Still here. Okay. Feel the border here. Again, you don't you don't need to friction. Actually, you just hold it according to the pain tolerance. Hold it. Are you okay? How's the pain?
Little bit.
Little bit only. Sure. Just take few deep breath, and you hold until you feel muscle is relaxed. That's your objective, eh? Until you feel the muscle is relaxed, you hold it. If you just do like this, actually, it's very painful. Eh? Any pain stimulation can cause muscle contraction, and all your purpose is totally failed because you want to relax the muscles, not to contract the muscles. Eh? That's important. So just hold it, okay, and ask your client to deep breathing. Hold, release, slowly. Perfect. Okay. If you think there's no pain or less pain, actually, then you can just glide like this slowly. Okay, and you can use your heel of your hand is more not sharp, eh? So it does not cause much pain like this only. Okay, this is the way you just squeeze or gliding. Eh? Make sure you're on the lateral border of the scapula. That's important. So back main challenge muscle is the scapula here. Around the muscles is scapula, on the scapula, under the scapula, superior scapula, medial scapula, lateral scapula. So all the scapula. Eh? So again, just do some effort. Repeat. So this part is pretty tight muscles we have. We don't do the massage because it's abdominal muscles only. Okay, and it's very ticklish spots for most of the clients. So this is your part, and you have to do massage here mostly, eh? And then here at the lumbar. This is purely lumbar region. Eh? So lumbar region, again, you use your heel of the hand, straight your arms, and use the body weight and glide. So to achieve all this posture, so what's the important thing? Height of table. If the height of table is not good, then you cannot achieve. Then you have to hurt your back like this or like this. Yeah, for you especially. So you can just use the heel of the hand, eh? In the lumbar region, eh? Just relax. And then along the iliac crest, pull upward, downward. You're massaging the glutes, and there's a main attachment origin. So most of the time you don't need to massage the belly. Belly is here, eh? But the attachment is here. You can do attachment. Attachment is here, insertion. Related to prostate, eh? And DFL or IT band. Okay, so you just massage here. Origin insertion method, you can just do. Okay, now you can use your thumb. If you can just do it like along at the side of the spine. You can just squeeze deeply. Or if the person is bigger, actually you can use now elbow, eh? Or electron process. Elbow electron process for the gliding, eh? Gliding. And if the client can tolerate, so you can use your knuckle like this.
Around the spine.
Yeah, around the spine. You can feel, eh? And there's another way actually. If you want to save the spine, put your thumb here and just glide. So your thumb is on the spine always, eh? So you're not working on the spine.
Yeah.
And then you can go back. Your thumb is on the spine. So it means the spine save. It is good if you massage a lean person or thin person with obvious spine. You can use your heel of the hand. Remember, this area is called the nephric area or nephric angle. There's a kidneys, eh? 12th rib and what lumbar vertebrae. They make an angle, and we have a kidneys here and here. So one here. So do not apply your non-poses or your like elbow in this area. And here also, because it's sensitive, eh? Your abdominal contents here, and here is especially kidney. So whenever you just work here, your pressure should be horizontal, eh? Like this way, not vertical. So Yeah, the way we just do the QL muscles here. QL is deeper, eh? We have more superficial muscles, and that is the ictus spinae group muscles here, me. So you have to penetrate your fingers just and hold it. Again, hold is very important. Eh? There's a way you can just do it. Okay. Are you okay? Yeah. Or you can just do from the other side as well as. Yeah, you can use your thumb like this. Slowly penetrating. Here you go. You go, just relax, and you can just pull it towards you like this. Are you okay? It depends how much your client just tolerate, handle the pressure. Right? Not all the clients. Again, you just do a approach. Use your heel of the hand. Yeah, the body. Now this side actually, then do the approach. Can I just try? Also loud. How are you? How are you feeling now?
Good.
Johnny.
Yes.
Heel of the hand. Remember, eh? What part? Heel of the hand. You can use your knuckles. Knuckles is more sharp, eh? Remember, it's good for the muscles group. Are you okay with pressure? There you go. Again, the same. You have to work supraspinatus, infraspinatus. Use your thumb. You can feel this stroke. You can feel the knots here. How can you feel knots with your forearm? Not possible, eh? So you have to use your palm and arm as well as.
Maybe you can feel it first and then use your arm.
Yeah, that's the part of your
Yeah.
palpation actually. Then you can just work. You can treat, eh? If you can't treat, how can you treat? Here I felt it. I found a knot, a big here. Are you okay? Are you okay now?
Yeah.
Getting down?
Mm-hmm.
Less?
Mm-hmm.
How much?
Two?
I did not jump, eh? From 10 to 2.
It's still the same jump.
8
From
Right.
8 to 2, that
Yeah.
means you are lying.
You're not a good model. So you can just work over the infraspinatus here and use again. So when you just work on deeper work like your frictions and your trigger points treatment, make sure you should not have oil like this. Actually, it's very slippery.
Yeah.
So what you will do, you just have to wipe the oil with a paper towel or a other
So
towel.
that,
Then we just do it. It's a good grip. Wait.
That's the one.
So you have problem this side, eh? More. Good. This is the way you assess, eh?
My good.
Is that good? Good for the modeling.
Yeah.
No, this is assessment.
Good process.
Yeah, this is good for assessment, eh? Because, yeah.
Yeah,
And then
it's
you just
small,
do. Are you okay? Many students absent today, eh? Are you okay?
That hurts.
No, it says sensitive. You're much sensitive than Arlene. Are you okay?
Yeah.
Just do some zigzag work here, and then again lower body. You can just do like your hands and move here, glide, body, and here. So right-handed person, there's one side is always strong, the other side is atypical.
Yeah.
You're typical. On your back, relax, perfect. So you can just strip the muscles like.
Some client, it's easy to to see
Yeah, exactly.
some
Younger
spots,
people.
The skinny guy,
Yeah.
the part is difficult to
Yeah.
find.
Chubby guy is very difficult, eh?
Yeah.
Especially, and in women, it's very difficult as well as.
Mm.
But you can do it. You know the
Yeah,
muscles.
for sure.
Yeah, exactly. It's ideal.
It's
So
not easy, yeah.
you're just doing muscles. You're not gonna. You cannot do dissection definitely. Yeah, whatever you have to do, you have to do over everything. Eh? Your idea about the muscles, locations, everything. So I prefer to push. Eh? The pushing is good. Let's wait. Only wait. Hold it.
Yeah.
Are you okay?
Yeah, should work.
Hmm. No pain?
No.
No pain. Yeah.
Getting better.
Better.
Anak ko, alasin ko na. Ulit ko lang.
Just relax. If you do prep, here you go. Just relax. No pain.
Fine.
5 is okay, yeah. Just
Fine,
relax.
yeah. Fine, it's good.
Oh, Johnny the hero.
Johnny is the hero. Johnny is the hero of the day.
Jan is the hero.
Yeah, okay.
Jan, Papa. Hello, Jan, Papa.
Again, the lateral border again, you have to push like this and use your both hands, thumb and hold. It's pain, eh? Hmm? It's sensitive actually, this is. Like lateral
It
side is always.
hurts.
Yeah.
It hurts.
I do that to my husband.
No.
It really, he's in pain. He said, I don't
This is
want to
correct.
be
Yeah,
pressed.
because- So,
My
but
husband doesn't like massage. I don't do for him.
And I never
Ask
did
He
massage
tried
to my wife.
Why?
Never.
He's my model, even for pregnancy. I'm like pretend to be pregnant.
You have like girls.
Are you okay? Again, you can just use the heat of your hand, see, glide, like this. It's less painful, eh? Only the pressure compression you're just doing. So pain is more when you just use the sharp part of your hands, like tip of your
Yeah.
finger, thumb, knuckles. There's pain. Not here, right? It's not painful. And just straight your arms, perfect. Here you go. And just do again the approach.
Yeah.
Me too.
Okay, the lumbar region, very tight muscles. This is very common to almost every person. Working people, they do have the lumbar tight muscle, low back, tight muscles, and knots here, SI joint, fibrosis. This kind is very common. And it's too light. Sometimes I use only one hand because it's difficult to use both. Only use one, but your body. Yeah, I'm using the body as well as. This is your just massaging what muscles here. The
Okay, well.
main focus is on
The
over the
origin.
iliac crest.
Yes, yeah.
Iliac crest here. QL is this actually because it's deeper muscles. QL it's very difficult to access the QL muscles. I do remember, like for a long time ago, I have a client, 65, 66-year-old, white, giant, big guy, and he has a low back pain. So before he was suspecting there's a kidney issues, he went to the doctor. Doctor did all the X-ray, all the image, nothing found. Nothing was there. So he went to chiropractor. He did some adjacent therapy for a while. Actually, a couple of days he felt good. Later again his pain.
Pain again.
Then he went for this physiotherapy. Physiotherapy did something, but they couldn't recognize. So what exactly? But there was a tight muscles. So he came to me. What I found, he had a trigger point in QL muscles, deepest,
Deepest.
very. So what I do, I use my elbow and just push because I'm a pretty big guy, electron. I just push and 3-4 sessions for half an hour. Okay. And he got relief of the trigger points. And he said it's been almost 2 years pain is gone. He was so happy at the time because if you relax the muscles, there's sometimes massage therapists can do a lot of things. It's not only the physio or chiro, okay, which you need to do.
Usually
Assessment is very
massage.
important. Assessment is very. It's not only the treating the trigger points. I give some hip flexure stretch, helps a lot. Hip flexure stretch, and some self care also. But he had a very bad trigger point in the QL. Again, this time is now. Is it okay?
Yeah, yeah. It's-
Are you sure?
Yeah.
No,
No. the same.
that's not
No.
the same.
Oh,
It's
It's
only
1 hour.
3:43.
Yeah.
Advance
It's
1
35
1 hour.
minutes now,
hour.
though.
It's 3:43.
35 minutes.
Yeah,
The
we're just
video.
waiting for.
But the my video.
So rest of the time you can just spend on the arms,
Yes.
okay, and legs,
Yeah.
lower limb, actually,
35
and then you can just do sometimes on your like
Only 3:43.
neck. Okay.
Come back.
Approach.
Approach again.
It was very slippery. I just want to give some stretch to him,
Yeah.
but I use his sheet. I'm gonna cover your back, okay? Don't move, eh?
Okay, I put it.
You wanna put?
Yeah.
Very good condition. There's $120 for an hour massage.
Yours?
Yeah.
Okay.